is Dr. Benzinger on Health with secondopinion.org. It's nice to have you with us. Today we're going to be covering proteins, specifically the 9 essential proteins, reason why they are that important. Missing just one of those proteins can make a huge difference in stopping your body from repairing itself, and unfortunately, or fortunately, proteins play such a massive role in so many factors of the body that you must have these 9 essential proteins in your diet on a daily basis. Many times people kind of consider that they're getting plenty, and the truth is we're finding, and I'm finding in my practice, not only is this uncommon for people to get all that they need, but it's becoming more and more common that I have to actually supplement it to be able to encourage a better diet. Okay? What we know is protein makes a big difference in hypoglycemia and diabetic states and many other conditions if it's the right amount in the right form and taken in frequently enough. So what we know is proteins are very valuable. There's many factors that cause these deficiencies in the diet. Poor dietary habits, malnutrition, impaired absorption, which happens in the elderly frequently, or people have chronic gut problems, will start having problems here because the body has to work pretty hard to get protein in the system. Infections, trauma, such as bumps, bruises, or athletic events will do it. Stress will do it. Drug use. You're on 1 or 2 medications. If you're on anti-inflammatories or painkillers on a consistent basis, you are going to have deficiencies in this area. And again, remember, age imbalances because of absorption and other nutritional deficiencies will create major problems, okay? So keep that in mind, okay? Why is it so important? Why is protein such a major issue? In the neurotransmission, in other words, 80% of all brain and nerve function is mediated by protein. In other words, it's not there, function decreases. Maybe protein has something to do with, on a consistent basis, some of these neurologic diseases that our elderly are suffering from that seems to be affecting younger and younger adults, and in some cases even children, but we call it other diseases. Moves the information from cell to cell. If you've got any problems with pH balance, you've read a lot about alkaline acid balance and imbalances. Well, the truth of the matter is pH balance is maintained in most cases to be alkaline, which is pro-health, by protein. Okay? Can you overdo it? Absolutely. Is it the most likely situation? No. You would have to overwork to do protein to a high extent over a long period of time, and it is dangerous to do that. The problem is most Americans are short of that, far short of that, and creating other problems. Okay? So we know that alkalinity promotes healthy cells and acidity promotes disease. So bottom line is deficiency in protein can cause edema, inflammation, and acidity, creating other conditions that don't need to be there. Remember, your DNA, your genetic code, generation to generation, is made up of proteins. And these essential proteins, if not present, can create havoc in such an area. So it's an absolute must. Proteins of the 9 essential are not interchangeable. In most cases, there's a few exceptions to the rule, but not enough that we should be covering that. Proteins are not interchangeable, so thus having all these 9, you probably never even thought about it, never thought, do I get 9 essential proteins every day? You don't even know, you have no idea, but we're going to cover that for you so you get a good idea so you know exactly how to add them to your diet. Okay, they're essential for growth and development, they provide energy, we know they make a big difference on the nervous system, and they're needed for hormones, for antibodies, fighting disease, enzymes, and all tissues, muscles, ligaments, tendons, organs, glands, nails, hair, vital fluids, and the matrix of your bone. Here's the whole thing. You might be taking all kinds of calcium all day long, even magnesium. You might be taking the vitamin D and zinc that we recommended for osteoporosis to help strengthen your bones and keep them strong over a long period of time. But don't have enough protein, there's nothing to hang it on, so it's almost useless without enough protein in your system. Okay? Here you'll see that we have an essential list of 9. 9 meaning when we talk about essential, essential means your body can't make them. If they cannot make them, your body has to actually get them in a diet form in most cases. Histidine, isoleucine, leucine, lysine, and you've heard things about lysine for cold sores, things like that, herpes viruses. Methionine, major for the DNA production. Phenylalanine, threonine, great for relaxing your body in the morning so that you can have bowel movements more easily. Tryptophan, which is major for your depression issues and the quality of sleep. Tryptophan is a big issue, and valine also. We're going to cover those in detail. That's what this session is all about. Okay? when we look at complete essential proteins and you look at them, meat, fish, poultry, eggs, soybeans, milk and cheese, and yogurt is highly recommended. It's one of the best forms to get it in for multiple reasons. So most complete essential proteins should be eaten in moderation. Why? Because most of those come from more animal-based sources, have a lot of extra fat, and if you're only eating it in that source, you're probably ending up with too much fat. So we're going to recommend that you balance it with other types of proteins, not just meat, not just animal-based proteins, okay? And the use of antibiotics and other chemicals that they use to raise chickens and cows and pigs nowadays are high enough that I think I would be concerned. And if you want to eat a lot of animal-based foods, move to grass-fed or free-range animals because you can eat more of these without the consideration of problems. Here's Bessie here, our local cow, and she's out grazing. So she's probably one that maybe you would want to consider having on the dinner table long term. And our favorite chickens that look sad but don't feel bad for them. If you get organically grown chickens that are free range, you're way ahead of the game, including for your eggs, okay? So when we actually look at the types of proteins that are out there, phenylalanine is one of the first ones we talk about. Dairy, meats, oats, wheat germ is where phenylalanine comes from. Remember, this is one essential protein. The reason why I go over this is because what if you find that there's one essential amino acid protein that your system needs more of? Okay, like tyrosine sometimes will actually occur, and the reason why tryptophan is actually a precursor to it, well, people who have thyroid and adrenal problems really benefit from extra tryptophan because they get more tyrosine. It makes a big deal. Hard to pull this all together, isn't it? But that's what we're here for today, is just to see if something matches up for you that you can try in a small amount and see how it reacts over about a 60-day period of time and see if it improves your general health, because it's a safe way to approach it. That's the reason why. What we know is phenylalanine has certain synergists that you want to take with it. So B6, B3, which is niacin, vitamin C, copper, and zinc makes phenylalanine work better. It also makes it absorb better. So again, getting in whole foods is the best choice, but you want to supplement appropriately if you find phenylalanine is a positive influence on your body, because here's what it does. It converts into tyrosine. So those people with thyroid problems, let me say it again, those people with thyroid problems, let me say it one more time, those people that are suffering from thyroid problems should pay really big attention to this, because this is a big deal. This is as big as it gets. Phenylalanine converts into tyrosine. It's a precursor to a neurotransmitter that promotes alertness, elevates your mood, okay? Moodiness, okay? Decreases pain, decreases appetite, want to lose weight, diabetes, etc., etc. Crosses the blood-brain barrier. It's necessary to produce thyroid and adrenal hormones. Necessary for thyroid and adrenal hormones. Do you know how many people are out there on medications they don't need to be? Doctor kind of knows this stuff, but doesn't even think that maybe I give her some phenylalanine or he some phenylalanine, that maybe they'll be in better shape. Why? Because functional testing doesn't give us this information today. When you do blood tests, you kind of take it for granted that everything's been covered. Let me tell you, everything's not been covered. I've owned a lab in the past. I know. That's just not the case. So phenylalanine might be helpful because it helps migraines, menstrual cramps, obesity, arthritis, diabetes, Parkinson's, and schizophrenia. People who suffer from skin cancer, diabetes, anxiety attacks, PKU problems, okay? High blood pressure should not take this supplement called phenylalanine. So you get skin cancer, diabetes, anxiety attacks, PKU, and high blood pressure. You might not want to take these, but if you don't have those, which are not so common except for the high blood pressure, phenylalanine might hype you up a little bit. So does it have a role? Does it make a difference? The answer is absolutely. Let's look at histidine. Sources: rice, wheat, rye. Okay, good grains. If you're allergic to wheat, you might have to stay with rice. Whole grain rice, whole grain rye, very healthy. Histidine synergists, things that work with it. Again, niacin pops up, B6 pops up, and vitamin C. So those three are staying consistent between the two that we've just covered. Histidine is essential for the growing your child. I mean, the growth and repair of tissue is dependent upon Histidine. So if you're an athlete, that's an issue. Maintains the nerve sheaths, the coverings of the nerve sheaths. Many of the diseases that we're seeing in nerve conditions are actually because the sheath itself is being eaten away or damaged or not rebuilding itself or not staying healthy. Red and white blood cell production is related to histidine. Protects your body from radiation. If you're getting radiation therapy, histidine might be something you want to add once your doctor approves it. Helps to remove heavy metals. If you're getting exposure because you work in mines or you're getting exposure to heavy metals for some other reason. And precursors for histamine. And histamine is what? Histamine is something that's actually productive in keeping your body well if it's supported properly. If it gets out of hand, you're taking antihistamines to stop some of the inflammation as well as a fluid buildup in the body. Decreases hemoglobin. It decreases hemoglobin overproduction. It helps anemia. In other words, it helps that hemoglobin actually get protein into it, so it's an important thing for people who have anemia. Inability to achieve orgasm in women. Histidine seems to help. Might be the only thing you're missing, ladies, if that's an issue. Rheumatoid arthritis, nerve damage. Isoleucine. Remember, you can stop a video, go back and replay until you get it all, including any of my faux you can get to too, because I don't clean this up. I try to do it real, like you're sitting in a seminar, just like I do it. So unfortunately, those that go to my seminars have to suffer through this. Isoleucine resources, almonds, cashews, chicken, chickpeas, eggs, fish, lentils, liver, rye, and soy. Isoleucine synergist are other proteins actually. It didn't need any other vitamins, it needs other proteins, valine and leucine, which we'll cover later. It's needed for the hemoglobin again, so we know histidine and isoleucine make a difference in your red and white blood cell production, okay? Stabilizes the blood sugar and energy, so if we've got diabetes, isoleucine is another thing to look at. Used in muscle tissue, again, athletes or physical stress on a constant basis is an issue. Aids in healing and repair of muscle tissue. So if you're not healing very well and you're a fibromyalgia patient, this might not be a bad idea to consider some help. What other things does help? Mental disorders, hypoglycemic symptoms, obesity, chronic fatigue, athletes, and surgical patients. So pre-surgery, when allowed, or after, you might want to have isoleucine in your diet on a higher level. You can get these isolated also, okay? Leucine resources, brown rice, beans, meat, nuts, soy, and whole wheat flour, not white flour, okay? Not unbleached flour, whole wheat flour. The synergist, isoleucine and valine, okay? And isoleucine, it was leucine and valine. So again, proteins, these 9 essentials taken together in healthy protein powders that don't have lots of sugar and junk in them might not be a bad idea. Okay, what's it help? It protects muscle damage, promotes healing of bones, skin, and muscle. It helps lower blood sugar. So again, diabetes and people like that, low blood sugar folks, that's probably why protein is such a big issue for those things, okay? Helps increase growth hormone production. So as you're getting older, we know growth hormone seems to go down, and this is an important thing. Provides muscle fuel, and athletes as well as surgical patients should make sure leucine is one of those things that are higher in their diet than many of the other proteins per se. Lysine. Beef, chicken, the sources, beef, chicken, remember we want you in these sources if you can get them in. Beef, cheese, chicken, eggs, tuna, potatoes, turkey, soy, and yogurt. You see yogurt quite a bit, so if you're not lactose intolerant, that's a great source. But don't take the lactase milks. There's multiple reasons, I just don't do it, okay, just trust me. Lysine synergist, B6, vitamin C, and bioflavonoids. Remember, vitamin C is actually made up, if you've seen any of our seminars, of multiple sources, and these are 2 of them. Vitamin C is ascorbic acid and bioflavonoids, okay? Helps lysine, okay? Lysine get into the body so it can be used. Helps lower elevated triglycerides, so this might be something you want to add. Helps build muscle, again, athletes and folks that have physical jobs or fibromyalgia type of symptoms. Important for healthy skin, so if you want to keep yourself attractive as long as you can, lysine's a good one. And in all these cases, okay, you take one lysine, let's say, by itself for a long period of time and you'll create problems. If you find lysine works, you blend it with the other 9 in another supplement, but take more lysine than you do the other 9. So you take care of your disease process or condition and maintain it, but you still got to have balance with the other ones. Don't ignore them. Keep that in mind, please. Aids children's bone growth, helps antibodies. So autoimmune diseases, arthritis and stuff, lysine might be important. Collagen, hormones, and enzymes to be produced. Assures adequate calcium absorption from the colon. So calcium-related problems, which is common in the United States, lysine should be there. It actually helps kidney stones, weight loss, anemia, bloodshot eyes, interesting enough, hair loss. I might be needing to get a lot more in my body. Hair loss, enzyme disorders, irritability, and can't concentrate and low energy. Maybe that's better than ADD medications. Maybe we should try lysine with some other essential 9 proteins at a high enough level and experiment with that on a safe level. See what's happening with your alternative family doc overseeing, of course. Methionine sources. Key for DNA, by the way. Methionine's not there, DNA's in trouble. Beans, eggs, fish, meat, garlic, onions, lentils, soy, and there it is again, yogurt. Methionine synergist, those things that help it be absorbed, B6, B12, folic acid, vitamin E, and vitamin C. Methionine is a sulfur source that helps fight free radicals. Free radicals cause damage throughout your cell structure, so you want to keep those under control. Methionine actually helps that. It assists in breaking down fat. If you're overweight or obese, carrying some extra pounds, methionine might be something you want to experiment with. Helps digest lecithin, okay? Lecithin's really good for keeping your cholesterol and your good fats in order. Detoxifies heavy metals. Prevents brittle hair, skin, nails, okay? That might be a big issue for those that got the soft nail problem. Helps fight fatigue. Might be an issue. Number 1 reason people go see a doctor, fatigue. Precursor for cysteine and taurine, 2 other proteins that are important. Promotes estrogen excretion. In other words, if you are estrogenic, hyperestrogenic anyhow, in other words, you're getting lots of exposures, you've seen our chemical seminar, you understand you're getting huge exposures, methionine on a higher dose might get more of the estrogen out of your system so you feel better and don't have that the symptoms associated with hyperestrogen, okay? Reduce histamine. Histamine is, often we're taking antihistamines. Maybe this is your antihistamine. Protects against radiation. Talking to the doctor, there's 2 of them now that we know helps when you're getting radiation therapy to protect cell damage, okay? And helps detoxification of the liver. People with chemical allergies are going to benefit. Osteoporosis, rheumatic fever, toxemia of pregnancy can be helped. Threonine or threonine, depending on how you want to say it, okay? The synergist is B6. B6 is a very helpful one. Threonine is actually gotten out of all meat products themselves, cheese, yogurt, and whole grains, threonine, okay? It aids collagen, elastin, tooth enamel formation, okay? For those that want skin, muscles, tendons to be strong and healthy, threonine is something to think about. Maintains protein balance, helps all the other ones work well, prevents fatty buildup of the liver. So for alcoholics or people that are taking drugs over long periods of time, threonine might be very protective for you. Aids antibody production for healthier immune system. For those that need a healthier immune system and have any HIV or those type of chronic viral symptoms or conditions, threonine may be something to consider. Vegetarians and low-protein dieters are ones that you have to worry about in these situations. Tryptophan sources. Tryptophan is something they've taken off the market for you to actually get by yourself without a doctor's prescription because people overtook it, trying to help their sleep patterns or their depression, overtook it and created other problems. Were there a lot of them? No, just enough that they could control it. But you can take something called 5-HTP, hydroxytryptophan, and hydroxytryptophan is a precursor, and you can try that because that you can get at any health food store. Sources you can get it in naturally though, brown rice, cottage cheese, meats, peanuts, and soy protein. Okay, so soy protein shakes might be helpful. Tryptophan's huge, huge, huge protein, very important. B6, vitamin C, folic acid, and magnesium help tryptophan get into the system. Okay? Tryptophan's, it's got so many things it does. I can't cover them all, but let's cover some of the basics. It's needed for B3 production, okay, which is niacin, very important vitamin in the body. Brain uses it to produce serotonin and melatonin. Melatonin helps you get deep REMs of sleep at night. Serotonin wakes you up during the day. And we know that it's serotonin that many of your antidepressants work on. So tryptophan, if they were in the right levels, you wonder if mild and moderate depression patients wouldn't be as depressed. And you don't have near the side effects with tryptophan unless you're ridiculous, okay? Helps combat depression, as we've mentioned. Helps control hyperactivity, ADHD. Maybe that's a possibility. Alleviates stress, reduces its effects on you, decreases your appetite. Overweight, diabetes, consider it. Alleviates migraines and enhances your growth hormone. As you get older, that might be something you need. So it helps insomnia, depression, autism, low pain tolerance, fibromyalgia again. And remember, in 1989, it was banned in the pure form, but you can use 5-hydroxyapatite to, 5-hydroxytryptophan to elevate it. However, if you're on antidepressants, make sure you talk to your doctor first. Your regular doctor. You don't have to have an alternative doctor on that one, okay? And if you want to try to wean off of things, work with your doctor. If you are taking responsibility and you're not crazy about how you apply things, we'll work with you on these things. Mostly, sometimes you're going to know more than they know in this area, maybe just because you watch this video. That's fine too. Valine, okay? Valine sources, dairy, grains, meat, mushrooms, soy protein, and peanuts. If you have a candida or yeast problem, you'd want to stay away from the mushrooms and the peanuts, just so you know, okay? Or have recurrent yeast infections, you stay away from those. It's found in muscle tissue. It's a stimulant effect on your body. You'll see sometimes in these speedy drinks that valine is in there. You don't even know what it is, but you see it. It's a protein. Kind of peps you up a little bit. Might be better than caffeine, by the way. Just don't overdo it. Make sure you keep it balanced. We've talked about that. Needed for repair of muscle, maintains nitrogen balance, and is useful in correcting severe alcoholic and drug addictions to help that person recover, okay? So keep that in mind, all right? What we know is protein is frequently lost with drug and alcohol addiction, vegetarians, low protein intake diets, and elderly that have a hard time absorbing it, or those people that have gut problems that are taking lots of these acid lowering medications. And the reason why is when you do, you can't break down protein to the extent that they should, so thus you don't absorb them, and thus many times you get lots of other symptoms. They don't even cover that, do they? Hey, remember, if you take this, we don't want you on long term. We want you to clean up your diet before we give you this little script for whatever anti-acid. None of that's covered. That's where we need to change things, and you need to ask questions so that you don't go through things that are actually harmful to you. Okay? So, the 9 essential proteins, are they essential? Absolutely. Are important? Absolutely. Something to look at, share with friends and family, and then make an appropriate choice. Make sure you take the element plus a balancer of the 9 essentials, and you're probably going to be okay. All right? Some people just increase their 9 essentials with protein powders or protein pills that we carry. The reason why we do, okay, a protein support is because it's pre-digested, easily absorbed, and easier on your system. In some cases, that's the only way you're going to get in enough, and I use them every day. We'll look for you next time. This is Dr. Benzinger on Health with secondopinion.org. May God bless you.